Hello everyone, welcome back to the channel. My name is Dr. Rosa, you can call me Dr. Rose. I'm doing this second vlog amidst this coronavirus crisis, again, to kind of keep you up to date and what's been going on and evolving step by step, even sometimes hour by hour, of what's been going on, all the different events, because we've been updated not only in terms of the propagation and the infection and all that, but also some of the changes have been going on in the hospital in our program, as well as in the US throughout. So as I said, not only the different services, but also in the hospital as well as in the state and entire US. If you might be aware of that, they're making a lot of different changes, looking to see how they can slow down the spread of the virus. For example, in the service that I'm on, we are told in the previous video, the population that I've been taking care of, an oncology population, a cancer population, which is one of the most susceptible and in many occasions immunocompromised. So the hospital for the patients is a very hostile place. It's a place in which we would like patients to get them out as soon as possible, as soon as they're stable and not needing any sort of acute intervention from our standpoint, because they are much more prone to getting complications. And so that's what we've been trying to do throughout the entire week, to get our patient list down, get them home safely. On the past video, I mentioned about a patient who was tested because of suspicion of COVID. I'd like to give you an update that that patient came back negative, and thus it provides a lot of relief. Not only for the patient, but also in terms for the rest of the team as well, because the rest of the team also got exposure to that patient. So yeah, that's kind of in the service, and actually all the services. And my heart goes to those, particularly in New York and in the state of Louisiana, to those in New Orleans. So as you might be, maybe aware, the atmosphere in the hospital, just like in any other hospitals, overall, it's very tense, not only because of what I mentioned before about the shortage in PPEs. And again, I'd like to extend a thank you to not only the individuals who have been able to donate PPEs, but also to the multiple different companies who have been able to donate thousands of different sorts of PPEs for all the frontline healthcare workers. So it's like a very big thank you to them. And the reason why it's so tense is because, we expect it to get much worse. The US pretty much hit or surpassed the 60,000 cases, New York being more than half of the total cases diagnosed in the US. So this is expected to, as I mentioned, get worse. So in our hospital particularly, they're taking multiple different measures to try to get that under control and try to have the enough resources and supplies to deal with this potentially worsening situation. For example, one of the things in our program, there are already 8 residents in quarantine, some of them because they have tested positive, others because they have any particular condition that makes them more prone to any sort of complications if they get infected. Also, just like I said in the last video, our work is fluid. So one day be in X service, and then I would get a notification for the next day to go to a different service to take care of different patients because of the growing need in different areas. They are trying to get the residents spread out in a way that is better for the patients. They're doing this because the residents are the main driving force, and because we're expecting this to get worse, they would at least have a reservoir, healthy residents, to be able to replace in case the current residents get either sick or for whatever reason the situation gets worse, be able to have healthy residents to take over the work and not be overloaded or overrun with the situation right now, same as still going on in Italy and Spain. In addition, we're still kind of having a shortage of the PPEs, as I mentioned before. And also another thing that's been going on in terms of our hospital is that the step-down unit is being converted to an ICU unit. Because we expect it to get worse, there is also an entire floor of the hospital sectioned off only for COVID-19 patients that has around 22 or so patients. Also, the state of Louisiana has seemed to be the state in which the infection rate has been the fastest overall. That's one example, or the example is New Orleans, in which the hospitals are being just overrun by patients having symptoms and being COVID positive. For example, as of yesterday, March 25th, confirmed cases was around almost 1,800 with an increase to 64 deaths. It's kind of continues to go up that curve, and we aren't seeing any flattening of it yet. In terms of the entire United States, there has been some recent debate, as recent as yesterday, in which the president mentioned to have the country opened up by Easter. Personally, and based off most of the evidence I've read and most of the experts in the front line assessing the situation at higher levels, it's not really feasible as it is expected. It's actually the contrary that's been recommended and continues to be recommended, because as Dr. Fauci said, we do not establish the timeline. The timeline is established by the virus. We do not determine if the virus is going to get transmitted or not. We can avoid getting transmitted. If the virus has a chance to get transmitted, it will. And it doesn't matter the hour of the day. So some people have been saying, oh, we can just let the economy collapse. Let's just enforce a daytime or a nighttime quarantine or martial law from certain hours. The virus works 24 hours a day. It doesn't matter if it's night or day. We need to enforce these measures and socially distanced, and those that are positive quarantined and isolated. The other point that has been coming up in this debate is sacrificing the elderly so that the younger population can go work. But the situation is that a virus doesn't discriminate in terms of who gets the disease or not. It's seen mostly in elderly, especially the complications, but we have seen a shift in the curve to more younger age groups as well. And if we have the younger population going out working, getting exposed, regardless of the elderly population, then the younger population will be affected as well. And thus, by doing this, there is the potential, yes, right now the economy is collapsing and we're in a bear market, what they would say, and there is a risk of continuing and collapsing economy. But if we just open the country so that the young working force can go out and work, they'll continue to be exposed, and then you'll just have the potential of just prolonging or kicking the can down the street of just collapsing economy, because they'll get exposed. Further on, they'll get symptoms, and afterwards you will have again an overwhelmed healthcare system, and as such we'll just end up as Italy is ending up with, having to decide between the 25-30-year-old who doesn't have any other medical conditions that it's in the ICU needing to be intubated, or having to decide between the 45-year-old patient who has just high blood pressure and having a family and a productive life, having to decide then to intubate the elderly patient who has multiple comorbid condition. However, they've been paying the Social Security and his retirement for his entire life. So we're going to be pushed into the situation in which we're not going to have enough resources if we just open up the country too early, because we're going to get overwhelmed and having to make these decisions of who gets to live and who gets to die. Until we don't see that curve flatten, we can't open the entire country. Also, there's been going on around the word chloroquine around as this miracle drug that cures the coronavirus. This needs to be taken with a very big grain of salt. We can't, I know that the president addressed this as the miracle drug and kind of a turning point, but the truth is that yes, drugs has been in the market for almost 30 years. The thing is that this drug, this family of drugs, the chloroquine, specifically the hydroxychloroquine, which is the one we're more familiar with, it's a drug that has been for a small study that came from France, in which the study just showed in a very, very, very small sample of patients, around 6 patients or so, that the use of this medication along with the azithromycin decreased the amount of viral load or the amount of virus in the nasopharynx. It did not show that this made any sort of difference in outcome. This is not necessarily a miracle drug right now. We need more research. We need to have standardized research in the labs to be able to determine that. What we see in labs doesn't always translate into humans. And yes, this is thus far, yeah, this may be the best thing we have right now. But again, this continues to be a novel virus, something that we are learning kind of as we go. And this is something that is kind of expected to happen, not like diseases that have been going on for years and we have a much better understanding. So yes, we are giving it to patients with kind of the expectations of for them to get better. But this is not, I want to just make clear that this is not necessarily backed up by an abundance of research, and this is not necessarily the turning point or the miracle drug. And that brings me to my next point, which is that this drug is not only used in, this is an anti-malaria medication, which is used in, for patients who contract malaria, yes, but also it is used for patients with some certain autoimmune diseases that have been taking it for years. And because of these irresponsible remarks that have been done by the president as well as the some of the government officials, this drug has come into shortage again in the same situation or in the same way that toilet paper, masks, other PPEs have come into shortage because of this panicky way of buying. People have been rushing into the pharmacies, just buying all the stocks of chloroquine to just take them at home and self-medicate, which is another terrible idea. Please do not self-medicate. Some people have gotten better, but we don't know if it's actually because of the drug or it's because the person's body was able to battle it out. The other thing is there was a case in which a couple overdosed on a chloroquine, which is used to actually clean fish tanks, and this is not something that should be happening. The man died, and the spouse is in critical condition in the ICU because they went ahead and took this similar sounding drug to self-medicate. We can't do that, and thus if we just take this medication and go crazy buying it and now there's a shortage, then these people who have been taking the medication and who actually need it are gonna be in dire need of the medication, and their conditions may complicate because of that. Please let the healthcare providers actually work with these medications and determine if you actually need them, don't need them, if it's appropriate or not. And as such, I do understand that this kind of vlog turned more into maybe a rant, but the situation is serious, yes. But again, we can't panic. I abide by my statements on my first videos in which we must stay informed, but we can't panic. We need to throw away whatever it is we see on Facebook or a infomercial that claims these all big things that can be of a cure, because there is no evidence thus far. If there is any evidence, believe us, healthcare professionals, scientists in the field will be the first ones to put it out there, because what we work for is for your well-being. So I will continue to keep you updated in as much as I can. We'll continue to work with the population. I'll be shifting services for next week, so I will be seeing different patients in a different scenario. I will definitely continue to sharing the experience with you and what I've seen so far. But please stay informed. Don't panic. Use reliable sources. Don't just browse on your Facebook or on social media, seeing every single little bit of detail. I know you're in quarantine, and this may be like a prime time to be scrolling on Facebook or some other social media. But if you're trying to stay informed for this situation and for the COVID, please use reliable sources. I'll be providing you with some of the links that I personally use to be able to keep up to date with some of the information, but especially keep up to date with the CDC and the WHO. The World Health Organization and the Center of Disease Control and Prevention are the organisms that are best resources for this situation. They have the most updated information. So until I vlog the next video and I upload the next vlog and give you an update in terms of the situation, I do encourage you to keep yourself informed, don't panic, and until next time, I wish you a happy and healthy life.